As you can see, this is my room. It is like very similar to a hotel room. I have everything, and nothing in this room actually goes out.
For 10 days, these four walls were all Haroon knew. Two doors isolated him from the outside world.
Every single bottle, every single paracetamol, every single IV, everything, all the needles, everything they use on me stays in this room.
He was rushed to the Royal Free Hospital in North London with a high fever, an early symptom of his monkeypox infection. Lesions and scabs in his throat meant Haroon couldn't eat or swallow. He was fed through a tube in his arm. It is one of the most extreme cases of monkeypox ever seen in the UK. Haroon has only just been discharged from hospital, but he is still in quarantine.
I am by myself alone. I don't have any family here, rather than my good couple of good friends. It was very scary. I thought that I'm by myself. I can't do this alone. And not being able to get help from frontline services was very scary.
Haroon called the NHS 111 helpline after having a fever of over 39 degrees for a number of consecutive days.
And every single time I heard the answer that goes, call us when you are getting worse. And I was already worse. I checked my throat, and my throat was all white with the I don't know, pus or some infection. It got to a stage that I couldn't even swallow my own spit.
Monkeypox is not, but can present like an STI. Sexual health clinics are usually the first to identify the symptoms. Monkeypox cases have trebled across Europe in the past 2 weeks, and the World Health Organization is warning that there can be no room for complacency. Vaccinations are being offered to some communities here in the UK, but the fear is that this rollout just isn't happening quickly enough. But the government's response has been severely criticised for being too slow and inadequate by a coalition of the country's leading sexual health service providers. It warns of vaccine shortages and says monkeypox risks becoming endemic in this country. We are united in calling for urgent action to prevent monkeypox becoming endemic in the UK. Since May 2022, the UK monkeypox outbreak has become a crisis, with case numbers rising steeply. Clinics are overwhelmed. Although the outbreak was unexpected, public health strategies have failed. We need urgent action now to eliminate monkeypox in the UK.
But it looks like we are in for an outbreak that's going to last for the rest of the year at least before it's averted. What we would like to do is to be able to have access to more vaccine more quickly and be able to distribute it more effectively. And all of that requires resource.
Haroon's ordeal is coming to an end, but the monkeypox outbreak is growing. Ashish Joshi, Sky News in East London.